The African Cardiorenal Metabolic Summit themed, quote, integrated approaches for cardiorenal health in Africa, convened top healthcare professionals to address chronic diseases like CKD, diabetes, and cancer. Amid Nigeria's 7% annual economic growth, experts stress the urgency of collaborative healthcare solutions. Global statistics show over 500 million people live with type 2 diabetes, 64 million with heart failure, and 700 million with chronic diseases. Dr. Salma Ibrahim, special advisor to the President on Health, reaffirmed the summit's alignment with President Tinubu's renewed hope agenda, emphasizing improved healthcare governance and increased funding.
We can't continue to operate, as it was mentioned in the welcome address, where a woman or a patient goes into the hospital on a clinic day for cardiac or hypertension, then another clinic day for kidney, then another clinic day. Where are the resources to do that? So integration is the key. And we said we have to have an integrated healthcare delivery in Nigeria, where the tertiary institutions that exist in all the federation, all states of the federation, will be able to contribute maximally to capacity development, mentorship, apart from their routine work of service delivery, training, research, and development.
Because we're not looking at the patient holistically. So the patient may start with me, it's a continuum. Patient will start with me, but needs to see the nephrologist, needs to see the endocrinologist. Can we make care seamless? And everybody needs to come on board. The nurses, the doctors, the pharmacists, all healthcare givers. So that is why we're here today. How can we integrate care? How can we make care for the patient who has a cardiokidney metabolic disease seamless? Because sometimes, the burden of even showing up for their follow-up clinics is such a problem.
The theme of your summit, integrated approaches for cardio, metabolic, and renal health in Africa, is very apt as it reflects the policy thrust of the federal government of Nigeria at this particular time. About 500 million people are reported to have type 2 diabetes. About 64 million people worldwide have heart failure, and about 700 million people have chronic disease. These three systems are related pathophysiologically, and therefore they are all interlinked. According to reports, evidence from practice and research in Africa indicates a rising trend of these triple threats, and a summit to address this disease is a welcome development.
Initiatives such as the Ilere Eco Health Insurance Scheme, which is the last one I was talking about, have been instrumental in providing affordable healthcare accesses, including screening and early diagnosis of non-communicable diseases. These have significantly improved healthcare delivery for the growing population of Lagos State. Additionally, this administration has made investments in medical infrastructure and partnership with private organizations to enhance quality healthcare management. These efforts align with the core objectives of this summit to identify innovative and sustainable healthcare solutions for Africa.